Hey, welcome back. This is Dr. David Cruz with White Coat Medicine Talks. I want to talk today a little bit about what a lot of you may have heard already about necrotizing fasciitis occurring with SGLT2 inhibitors. And I want to go into that just a little bit more, but I want to talk about diabetes in general so that we can kind of discuss what we see with diabetes first of all, because diabetes in itself is a very, very terrible disease if not well taken care of. The medications that we give you are basically there to make sure that we get that sugar back into control. SGLT2s are one of the newer medications that have been out that are really helping doctors get their patients back to the levels that they need to be. And they're doing a very good job of this, and a lot of doctors are having success and a lot of patients are having success because one, they're getting their sugar back to where they need to be, and also they're losing weight as well. And you combine those two things, diabetes gets much better, the patient does better, and overall we have hopefully less complications. And we'll go into that a little bit more. But let's talk about diabetes complications first. One of the big complications of diabetes is amputations. And you know, about 67% of the amputations that happen to the lower limb are due to diabetes here in the United States. Now, it's estimated worldwide that about every 30 seconds there is an amputation of a lower limb due to diabetes. So that is a huge number. For instance, 2010 there was 73,000 amputations of the lower limbs that were due to diabetes. So you're talking big numbers, you're talking huge numbers of people having bad side effects from diabetes. This is one of the reasons that we really stress that we need to take care of the diet, exercise, and take your medications so that we can try to avoid these complications from occurring, which is one of the reasons that we combine medications like statin medications to decrease your cholesterol, aspirins to make sure that the circulation is good and decrease the chances of heart attacks and strokes. And we do all of this in diabetics because we know the big risk that occur with diabetes. So let's go beyond amputations and go on to other complications. Let's talk about your eyes. Retinopathy, very, very common in diabetics, which is why doctors send you every single year to try to get your eyes checked, to look at the back of the eyes to make sure that you're not having more blood vessels growing in the back of your eyes causing retinopathy, because you can have bleeding back there and then of course lead to vision loss and blindness. And it's very, very likely to happen in diabetics, and so we try to take care of everything. So trying to control the sugar, we're trying to hopefully control that as well. Now, diabetics are 2 to 4 more times likely to have a heart attack than people that don't have diabetes. And about every year, about 44% of the new cases of kidney failure every year are due to diabetes. And so you start seeing all these risk factors that now you have with diabetes and why it is very important to control. There's also a higher risk of stroke. More people with diabetes are going to have stroke. Now, we worry about the arteries clogging faster, so you have peripheral vascular disease where you don't have good circulation to your extremities, your hands, your feet, your legs, which then leads to neuropathy, which means your nerves start dying and you start getting these bad pain sensations and numbness all over your feet. And then you can get ulcers, you can get fractures, you can get amputations at that point as well. And worse, you can get ulcers that then get bad infections and can kill you. So you can see the dangers of diabetes and why it takes so much care on your doctor's part and on your part and your family's part to make sure that your diabetes is under control all the time. Makes a big, big difference when you control these things. Now, let's move on to the SGLT2 inhibitors. These are medications like Jardiance. Now, Jardiance has been shown to decrease death from heart attack and stroke already. And so it's a medication that's doing great. Other than just controlling your sugar, it's showing great benefits in your life as well. We have medications like Invokana, Steglatro, Farxiga. So all of these medications, and then they also make them in combinations with metformin and other medications as well. So they go by some other names as well. Now these medications, what they do is they take out your sugar from your system through your urine. So we always recommend for patients to take these medications in the morning, drink lots of water throughout the day because you're going to go pee a lot of sugar out. And we always tell patients that when you have to go pee, go pee. Do not hold it. Go pee and then clean yourself well. This is where this complication now comes in. People can get a lot of urine infections sometimes and yeast infections with these medications. And so we have to make sure that there's very good hygiene. So you have to clean very well your perineal area so that you do not get any type of possible yeast infections or bacterial infections or UTI or anything like that. So what we have been hearing is these cases that occurred of necrotizing fasciitis, which is called Fournier's disease or gangrene, Fournier's gangrene. And so this complication is a bacterial infection that happens in the perineal area, in your genital area, and it can kind of kill off all your skin and cause severe changes and damages and surgical debridements that have to be happening on this area. Now, from 2013 to 2017, the amount of cases that were reported, 12. There was 12 cases. Now in 2017, about 1.7 million people were taking SGLT2 inhibitors. Okay, so you can start seeing the numbers as to how many medications, how often we use these medications, and the lower numbers of these events that happen that were reported. There was 12 cases that were reported. Now, there could have been more cases that were not reported, but 12 cases were reported, at least according to whatever on the FDA. There was, I believe, 7 men and 5 women that had these infections. Now, what we need to do to look out for these things is make sure that you're in the lookout for any pain to your genital area. So if you're already taking these medications, which have been proven to be very effective, make sure you don't have any pain to your genital area. Make sure you don't have any swelling, any redness that may occur to that area as well. If you have the pain that goes from your genital area back to your rectum area, that would be a problem as well. If you have fever, that's a problem. And tender to the touch as well would be a big problem as well. So you have all these symptoms that can occur. Now, with diabetes, a little infection can become a huge infection right away. Do not wait. Please get checked out and make sure that it's not something bad very fast. Tell your doctor or get seen somewhere if you cannot see your doctor. Now, I would tell my patients to stop the medication if they have any of these symptoms. Even if they just have urinary tract infection symptoms, I tell them stop that medication, wait until we treat it, wait until we culture the urine before we start that medication again at that point. But now if you have something that looks like it could end up as necrotizing fasciitis, which is kind of a more severe infection, and then that would be more severe, and you would not be back on these medications at all. So the way I would recommend my patients to take it, and when do we use the medication on patients? Now, if somebody comes in as a new patient and their sugars are slightly high, just maybe 180s, 190s, 200s, or 200 and down, then maybe you can use this type of medication for that patient if they're overweight and they need to lose a little weight, plus control that sugar, and they would probably do very good that way. Now, where would it be a little bit more dangerous to use this medication? I think if you were a new patient, again, you weren't on any other medications, and they would start you off on this medication first, then there's potential that you might be getting rid of too much sugar, a lot of sugar through the urine, and maybe increase your risk for more infections at that time. So the best option, I would think, would be to start you on other medications first, get that sugar as controlled as possible. And once it's as controlled as possible but still not reaching the level, then this medication will do wonders for you. For those people that it works very good, it works really well. Now they do lose some weight and their sugar becomes very controlled, and that's what we're trying to do with diabetes. Now if you're taking these medications right now, don't make the mistake that a lot of patients make and stop the medication, and then 3 months later go tell their doctor, oh, I stopped the medication because I heard there was an infection thing going on or something like that. If you do have concerns, talk to your doctor now and discuss it with him. You know the symptoms that can occur if you have urinary tract infection. It burns when you pee or anything like that, then, or you're peeing very frequently and it does bother you, or you have fevers, and that's a reason to just stop the medication. Call your doctor and make sure that they see you so that you can adjust the medications for you, and maybe check the urine, check the genital area, make sure you're not getting a bad infection or anything else. But that would be what I have to say about this. It's very important to make sure that, like I said, don't stop the medicine if you're doing fine. If you're doing great, you don't have any symptoms, any side effects, your doctor has been checking you, your hemoglobin A1C is actually coming down the way it should. Now you should be dieting and exercising, because as this medication helps you lose weight, maybe you can start doing more exercise, maybe you can start getting in better shape, and maybe you can control that sugar much better, and hopefully at some point that we can get you off medications. And that would be the goal. The goal would be to eventually get you off as many medications. Some people can't get off medications completely, but we can try to get you as best as possible so that you don't have to use medications as much. But just remember everything I said about what diabetes happens at the beginning of this video and all the complications that can occur, and that should kind of sway you in the direction of making sure that you want to get that diabetes treated and not be concerned about things that you just read on the internet or just hear by a neighbor saying, oh, that's a dangerous medication or anything like that. Let your doctor talk to you about those things if you do have concerns. And thank you very much for listening today. I wanted to get this video out because I think it's major importance, and hopefully you've learned something today. And thank you for listening, and we will talk to you next time. Take care.